This seminar is for educational purposes only. It is not a substitute for professional medical advice or treatment. Consult with your medical provider for medical advice or treatment. Although the presenters try to keep the information in this seminar as accurate and timely as possible, the speakers and Mather Hospital assume no duty to ensure the seminar is error-free. The speakers and Mather Hospital are not responsible or liable for any claim, loss, or damage resulting from you viewing this seminar.
Good afternoon, everybody, and thank you for joining us for our Healthy You webinar series. Today's topic is From Screening to Thriving with the American Cancer Society. At any time during the presentation, please feel free to enter any questions you may have using the Q&A feature at the bottom of your screen. We will answer as many questions as we can within the time allotted once the presentation concludes. Your questions will always remain anonymous. And today's presenters, I have Maribel Vargas and Katie Gofrich-Schaefer. All right, guys, I'll hand it off to you and take it away.
Well, thank you so much for having us. We're thrilled to just be a part of your day today. Northwell Health has been a longtime supporter of the American Cancer Society, and we thought we'd kick things off by starting with a video. So I'm going to have Maribel, if you could, before we introduce ourselves, let's show the video.
Absolutely.
At the American Cancer Society, we exist to end cancer as we know it, for everyone. Everyone, like the 1 in 2 men or...
I'm sorry.
Maribel, I don't see it on my screen. I'm sorry.
Right, let me just share it again. Do you see it now?
Yes.
Perfect.
At the American Cancer Society, we exist to end cancer as we know it, for everyone. Everyone, like the 1 in 2 men or 1 in 3 women still at risk of getting cancer in their life, a reality that only motivates us to do more. Like funding breakthrough cancer research and using advocacy to effect meaningful change, more like enhancing patient access to quality care and supporting patients in their cancer journey, all with the sole purpose of ensuring everyone has an opportunity to prevent, detect, treat, and survive cancer. From our dedicated ACS team members to our cherished volunteers and partners, we won't stop until we're able to have a meaningful impact on every cancer and every life. That's why we do all that we do. From our Hope Lodge communities, providing a home away from home for people with cancer and their caregivers, to our work to close the Medicaid gap to ensure affordable treatments and access for all via our American Cancer Society Cancer Action Network. It's why we've funded billions in research, contributing to 3.5 million less cancer deaths. And that's only scratching the surface of all that we do. Our organization isn't one that just talks. We act. And when we act, we affect millions of cancer journeys every day. Together, let's continue to take on every cancer and change every life. American Cancer Society. Every cancer, every life.
Thank you, Maribel. And again, thank you so much for everyone for coming here today to just listen about the ACS programs and services for patients and healthcare providers. My name is Katie Gofrich-Schaefer. I'm the Executive Director for the American Cancer Society. I sit here on Long Island. And with me today, I have my colleague, Maribel Vargas, who is our Associate Director for Cancer Center Partnerships. And she specifically works with Northwell Health every day to ensure that our work and your work are working together to ensure that we're serving as many patients as we can in our communities, because we can do things better together. In 2025, over 2 million new cancer cases will be diagnosed, and 618,000 of them will result in deaths here in the United States. And cancer incidence continues to rise for many common cancers, especially for women. But cancer mortality continues to decline, which is a big win. And those are wins because of smoking cessation programs, early detection, and treatment advancements, and that have reduced those mortality rates by over 34% in the last 30 years, sparing about 4.5 million lives. So today, our work and what we hope to work with you is how you can, prioritize your own healthcare journey to hopefully minimize your cancer risk or be directed to some great resources for you and your families, but also expand your knowledge on what the American Cancer Society does every single day when it comes to patient cancers and their families. So first things first is we have just recently released a healthcare assessment called Cancer Risk 360. And we know that everybody's healthcare and cancer risks are different based on different environmental factors, physical activity, lifestyle choices, what have you. So we invite you, and we're going to be sharing a lot of links after this program so that you don't have to take a million notes. But we actually encourage you not only to talk to your doctor, because that is the most important thing, but also have a better idea of what your cancer risks are as an individual based on this 5 to 10 minute survey for individuals who are over the age of 18, and how you can adjust behaviors or take into consideration different opportunities to ultimately reduce your risk for cancer in the future. Next slide. Okay, Maribel.
Perfect. Yeah. We know that stop smoking is hard. And one of the things that we are doing at the American Cancer Society is that some of the studies we are doing about early prevention is about how can we help people to stop smoking. And studies shows that stopping smoking is really hard. Actually, from 4 to 7% of people who they decide to quit, they do it by themselves. I mean, like alone, with not help, like cold turkey or it's really low percentage, right? Then the American Cancer Society and the researchers are developing this tool that helps people to stop smoking. The way it works is that it's like 3-step program where you decide a date when you want to quit, and you're going to start receiving emails about like how do you prepare better for this, making a plan, and what do you need to prepare, like what type of other cravings could you like to have? I mean, to substitute the smoking with life changes you can make. How can you incorporate more physical activity, or if you need like other type of support with patches or any other things. I mean, they see what have you tried before, what have worked for you, and this program, it really helps people to stop smoking. This is a beautiful program because you are not doing it alone. I mean, you are doing it with us, and you will receiving advice about how can you get better results about stop smoking. We know that always is a good time to stop smoking, and never is too late. And we know that tobacco is linked with different type of cancers, and is beneficial at any age to just stop smoking. We want to be sure that everybody improves their health, and we know how hard it is stopping smoking, and we just want to be sure that people can reduce the risk of premature death, and how can we add more expectancy in life. And we have different materials in our websites about like how tobacco is related to different type of cancers, and many other diseases. You can have more information in our website and our phone number. And as you can see on the slide, we have cancer.org/empower to quit. And you can have more information there to subscribe. You can put your email, your name, a little bit of your history. And this is for anybody who smokes. I mean, it's completely free, and this is something available for everybody at any time.
Thank you, Maribel. So as we move through our program, I think that, when you think of the American Cancer Society, everyone has heard of the American Cancer Society. And I think a lot of that has to do with that we're the #1 funder, private funder of cancer research besides the US government. But there are so many programs and services that are available to our community members who are undergoing a cancer diagnosis. And to access these programs, you can do it through 2 ways. One is through our 1-800-24/7 helpline. which is open every single day, day and night, holidays included, and that is 1-800-227-2345. Or our website, cancer.org, we have a live chat feature. And if you ever have heard the words yourself, you have cancer, or a loved one has heard the words, you have cancer, no matter if you are with a nurse or in the healthcare profession, it is so important to know the resources that are available to help with that that diagnosis and that journey. So this number is like probably the end all be all of the American Cancer Society, because even if you retain one thing from this meeting, it is that we're here for you and we can connect you to the resources that we have. So we have trained specialists on the other end of this phone. They can provide a listening ear. They can talk through your cancer diagnosis. They can provide different types of questions that you can ask your healthcare provider, as well as getting you connected to the services that we're going to be talking about. This resource is available in over 200 languages. So it's just a fantastic resource for everyone. And also, if you're reaching out you can reach out for a patient themselves and help connect them. Next slide, please. So as you learn about what we do at the American Cancer Society, we know we can't do everything, right? So we make sure that we are working with different community organizations across our community to ensure that we're figuring out what they do, whether it's financial assistance, screenings, different house cleaning, whatever it may be. And we compile that information and put it in our Cancer Information Resource Center, where people can access with their zip code what resources are available to them. But also, if you do call our 1-800 number or go to cancer.org, you're able to actually get connected to these resources as well through there. Maribel, you want to talk about ACS Cares?
Of course. We know that once somebody has a diagnosis, we have to coordinate a lot of things related to care. We have to coordinate all the logistics for treatments, for side effects, for any nutrition tips, any modifications we need to make. All this is a lot of work, right? And the American Cancer Society has developed this app that is called ACS Cares, and CARES stands for Community Access to Resources and Education. And the main idea is to put all these resources together for you. I mean, we have a QR code. We invite people to take your phones and just log in and download the app. It's completely free. And the main idea is to create a small profile, because not everybody has the same type of cancers. Not everybody has the same age, or I mean, all this is we're gonna customize all your information to give you the best information depending on the information that you provide to us. And you can get access to all our main services through the app. I mean, it's in one place, everything. And we have also this app available in Spanish. And here, I mean, the main idea of this app is to help you to coordinate with all the medical care about like treatments, decisions you need to make, and about all the information you can have regarding what is the best action for the type of cancer or for the program that the person is having, right? It could be from caregivers, or it could be as a patient. I mean, we can download the apps, and it's available in for different type of platforms. And you can get also the information through our main programs through this app. As you can see here in the slide, I mean, it's personalized support from trained ACS volunteers. I mean, we train all our staff to be sure they are able to provide the information you need. We connect virtually with trained community volunteers who they share the same experience and the background, including diagnosis, location, military status, race, and ethnicity, because we want to be sure that people get matched with people who they are very similar to the person who needs the information. We provide reliable information on addressing all the important topics such as emotional health, finances, transportation, and dependent support. We know how important all are these topics, and we have like different type of tips. We have different type of organizations who they can support in different ways, depending on your zip code, depending on what you're looking for. Katie mentioned about 24/7, the helpline that we have 24/7, and we have it available in different languages. And now, I mean, I mentioned in this app that is very helpful for us to provide all these programs that we are providing to the community when they need it. And one of the main programs that we have is called Road to Recovery. This is a transportation program that the main purpose is to reduce the burden, and we are doing it by providing free rides to cancer-related medical appointments. We have trained volunteers that they're gonna pick you up and drop you at the cancer center, and you need to do it at least 3 days in advance. It takes time for us to develop the information, to pass it to the volunteers, and the volunteers make the plans to pick you up and confirm with you that they're going to be driving you. And it's free. It's available in many counties around New York and Connecticut and other states. This is a nationwide program. If you or you know anybody who needs this program, please call the 800 number, and you can just provide the addresses there, where are you going, the dates and everything. And this is a beautiful program. It's also a great way to give back to the community. And always we are needing drivers. And talking about needing drivers, if you know anybody who is going close to retiring, or who your parents who they are like looking to do something, I mean, we are always looking for drivers. I mean, you can drive locally, you can help your community, and the only thing you need is to have a good driving record, a driver license, proof that you have an insurance, you have a car. And usually the rides are during the weekdays, because it's when people will usually get the treatments. And if you have like a regular desktop or a laptop or a tablet, I mean, where you can have access to this information that we're going to be sending you back and forth. I mean, that's it. And you need to take a small training. And if you need more information about the program, there is a QR code there. I mean, I'm a driver myself, and I love driving patients. Each time I open the door of my car, it's a new story, it's a new connection, and it's so nice to help our community in that way. And the good thing is this opportunity is very flexible. It doesn't have to be like 3 days a week. It doesn't have to be a specific time. I mean, you can check your calendar when you are available, or when you are around that area, and just take that ride. I mean, that is the beauty of this program. And in the bottom part of this slide, I mean, you can see all the counties where we have already drivers. And the program is very active. I mean, thank you to this program and all these volunteers and everything, we are able to help that people get the treatment that they can save their lives.
Yeah. Thank you, Maribel. And I will say that our program here in Nassau and Suffolk County is actually one of the top road to recovery programs in the country, based on people understanding the need for it and the fact that people need their service, which is great to see that we're fulfilling so many rides. Another one of our amazing programs that we have at the American Cancer Society is our Hope Lodge program. And what this is we have over 31 lodges across the United States, which are free homes away from homes for people who are going through a cancer treatment, where they can stay with a family member for as long as they need to. So we have actually our Hope Lodge right across from Penn Station here in New York City, where Northwell patients are able to take advantage of this amazing program. But we know that sometimes the clinical trial that you might be on, or where you need to go to treatment, may be far away from home. So by having a Hope Lodge, that provides the savings and the stress of being able to pay for that hotel room, or making the decision to go through with that treatment, which is such a nice relief. It is a wonderful, wonderful place. The Hope Lodge in New York City actually is larger than most apartments in the city with more storage space, which is just hysterical. Everybody knows that, with laundry and whatnot, amenities, kitchens on every floor. But it really creates this amazing bond. And if anybody is interested in coming and visiting Hope Lodge, please reach out to Maribel or myself and we can provide a tour for you. Or if you're in need of Hope Lodge, you just need a referral from your social worker. If we don't have a Hope Lodge in the vicinity of your treatment, we have a partnership with Extended Stay America. And this is a great partnership because we're able to get discounted rates for hotel rooms for people. Again, you can are able to access this through our 1-800 number that we talked about in the beginning of the call. And also there are opportunities for discounted caregiver rooms with this program as well, which is nice, a nice resource. Maribel, would you like to share EverYou?
Of course. Another of the program that we have is called EverYou. In the past, we had a catalog. It was called TLC, like Tender Loving Care. And now we are revamping these materials, and we changed the name to EverYou, but it's kind of the same concept. You can buy any type of products that they are related to treatment. It could be wigs, it could be bras, it could be foams, it could be silicone pads. And we have like a big variety of things that you might need for treatment, and you don't know sometimes where to buy them, where to get them. And you can check these ones online. I mean, the main idea is to create this place where you can find different type of products. You can buy them by phone. I mean, if the patient doesn't have a computer or the patient is not able to move, you can call the phone number that is the 1-800-850-9445. And you can get the products to your home. I mean, and you can, so many things that sometimes they are needed, like could be like compression garnets, supportive bras, camisoles, heating pads. I mean, even though there are products on sale, and they have different type of tips where you can find information about hair loss or about how do you prepare for before surgery, or all different type of mastectomy products. And they have tips and guides about what to do before if you are losing your hair, and all the different type of products they have. It's a great tool to have. I mean, the prices are very affordable. I mean, and if we compare them with the prices out there, I mean, the prices are really affordable. And sometimes when people is not able to afford them, I mean, please call the 800 number and tell them. And sometimes we have some vouchers available, and we are happy to support when we can. The next one, we have also a Cancer Survivor Network. We know that usually many of health systems, they provide support groups for the most typical type of cancers, but there are other type of cancers, but they don't have as many people. But still, we want to get together and talk about maybe esophageal cancer and or brain cancer. I mean, where can I talk with somebody who are going through the same, or just asking questions about side effects, or I mean, any type of information. I mean, we have this Cancer Survivor Network that is an online peer support community for cancer patients, survivors, caregivers, families, and friends. Anybody who is interested in learning more about this specific type of cancer, you can create a profile, and you can enter and participate, make questions, make comments, publish something an article that it was new, or something that helps you to understand better treatment or options or anything. I mean, that is a great way to connect with others when it's now with the virtual space. It's like so easy, right, to get involved with all these support groups. And this one is the platform from the American Cancer Society, and we're just facilitating this communication between patients, caregivers, or anybody who's interested in learning more on this type of cancer. We also have a caregiver guide. We know how important is the role for the caregiver, and they play a crucial part on any cancer care team. I mean, they are in charge of coordinating all tons of questions that they might have about, like, treatments, choices, behaviors, how to leave the patient, or how can we help the patient. I mean, and they are the ones who they take care day to day, all the tasks. And we just want to provide with some information and guides for them. How can we help them to understand better? We also have a caregiver support video series, and this series we have videos about self-care, nutrition, coping, communication, caregiver resources. I mean, we have all these way to help how draining, lifting, pain management. I mean, all the side effects. I mean, all these videos are very helpful to support our caregivers that we know that they have a critical role in the care of our patients. And also, I mean, other videos that we have available is like taking time off, or when you are going back to work, how do you create like this transition, going like little coming back to work, and that is very good tips and about how can we do it better. We know that also if anybody's interested in helping us to be part of research and advancing science, I mean, we also have this new program that is called ACS ACTS, that is Access to Clinical Trials and Support. And the main idea of this program is to facilitate communication between clinical trials and patients. We know how hard it is to learn about a clinical trial that maybe we qualify for, but it's in California, or maybe it's in Florida. I mean, it's really hard to understand where can we find clinical trials. And as we know now, I mean, all the clinical trials, I mean, they have a very strict ethical standards, and the safety of the patients is first, and everything, all the data is reviewed, is audited, and the participation is completely voluntary for all the participants. And all the information about each clinical trial is detailed about like what is a clinical trial, what is our role, how is the participation, how is that helping, I mean, about the data, and everything is very well explained on each of the different clinical trials. And well, I mean, here we are inviting you to learn about clinical trials, to connect with the American Cancer Society, and access to programs and that we have available for everybody. We also have resources for healthcare professionals. I mean, we know that we have a big partnership with the American Society of Clinical Oncology, that they are the main organization who determine all the guidelines for cancer care. And we have, at the American Cancer Society, we have journals. These journals is where we publish all our different information. I mean, we have different types of journals, and we publish everything related to early prevention, early detection, treatment, survivorship, palliative care, cancer care. All these different topics are available in our journals and publications. We also have professional education and training. We provide for providers, I mean, fact sheets, presentations that you can use. You don't need to recreate everything. If you are looking for how to make a presentation about breast cancer, we already have the information there for you. And we know how important is health literacy and how important is to provide information to patients. Then we have created a list of different flyers, and that we have topics like the breast, cervical, colorectal, lung, ovarian, prostate, skin cancer, diet, physical activity, cancer care, tobacco, LGTB communities. I mean, we all have different type of resources available there. And we also have the materials for patients. And finally, we have the ECHO projects, that we know that the ECHO projects are the ones to help us to disseminate all these strategies in other areas. I mean, we have a group of experts who they are very good in their areas. For example, we just finished a ECHO project on biomarkers for lung cancer, and it was interesting to see how it was 6 sessions once a month, and each session helped us to identify each of the steps to implementing the biomarkers. and we have about breast cancer, and we have a big list of how can you can participate in any of the ECHO projects if you are interested in participating in any of them. We also have the guidelines that we were talking at the beginning. I mean, how important is from the American Cancer Society to determine what do we suggest to have better care. I mean, as Katie mentioned at the beginning, I mean, a lot of people is going to be diagnosed for cancer. We have almost 2 million people that is going to be diagnosed in 1 year. But how can we make it easier? Then early detection and screening guidelines is one of the answers. We can help people to identify if they have cancer in a very early stage, or even though before they become cancer, especially, for example, with colorectal, right? When we find a polyp, I mean, the polyp is, it might develop cancer, but if we take it out, I mean, we are preventing them for happening. And all these guidelines are so important for us because we can't say that, for example, for women, I mean, we are recommending that women can start mammographies between 40 and 44 years old if they have family history, they have certain, if they are from Pacific Island, for example, they have a higher risk. But if for everybody else, I mean, we suggest to start at 45 for sure every year to have a mammogram. For colorectal, I mean, we also have screenings where they can start at 45 and until 75. And that's the recommendations we have depending on all different type of studies that we have done and all the research that we are doing with our scientists. We also have guidelines for cervical, for prostate, for lung. I mean, everybody who smokes, I mean, we recommend to have a low-dose CT scan because that is very important for them to identify if there is anything in their lungs. Or if you were a smoker, I mean, that we have also recommendation about what do we recommend for that. And we, as you can see, we have different type of links here, and we're gonna put all the links for you to have access to them after the presentation. I mean, you can play with them. We have very important information about also HPV, for example. I mean, this is the only vaccine that prevents 6 different types of cancers. And we are pushing very hard to for parents to just help to prevent their children to getting this HPV. We also have an interactive gallery, and this one is a very high quality images that you can play and you can interact with them. I mean, you can once you receive the link, please click on 3D, and you can zoom it in and out like very easily and have access to the different type of views, and you can help patients to understand what is the cancer, what the treatment is doing, or what can you do it in a better way. I mean, the quality of the images are really good, and I highly recommend it for you to use them and to learn about them. Is completely free to have access to all these different tools. And finally, we also have a list of different roundtables. These roundtables are helping us to put all the information, research, and efforts to create better guidelines for each different type of cancer. If any of you is interested in learning more about the roundtables, please let me know. I mean, we're always looking for volunteers, for doctors, for anybody who wants to join us and just create more awareness about the importance of being part of cancer science, and also being part of these important organizations who they help us to coordinate efforts to reduce every single part of this type of cancers.
Great. Thank you, Maribel. So as I mentioned earlier, the American Cancer Society is the largest private funder of cancer research besides the U.S. government. So things that we actually do have grants. You're able to apply for grants, and we do have active grants at Northwell Health to date, which is exciting because research is happening right here on Long Island. research really goes throughout the entire gamut. We are not cancer specific or only fund different like specific types of cancer. We really try to look at cancer holistically. We look at we fund different types of cancer sites as well as how cancer affects cancer disparities, as well as those healthy eating and active living types of topics. Every year we publish our Cancer Facts and Figures document, which just talks about cancer incidence rates, mortality rates, how it's affecting different populations, and just all the findings that we are seeing from our research lens, which is exciting, and obviously looking at that early detection lens as well. One of the things that we're doing when it comes to research right now is that we are actively recruiting for our Voices of Black Women cohort study. Can you switch slides? Thank you. Our Voices of Black Women's cohort study launched last May. And what we're trying to do is we are trying to follow 100,000 Black women who have never been diagnosed with cancer between the ages of 25 and 55 to work with us and let us follow their healthcare journey for a number of years so that we can better understand why Black women are dying at a significantly higher rate than their white and other nationality counterparts, which is really something that we need to take as a priority when it comes to healthcare journey and understanding how we can make generational change. So we're asking and inviting anyone who is interested in this study to join. You can learn more about it at voices.cancer.org, or of course reach out to Maribel or myself after this program to talk about what's involved. It's survey based, so you would just sign up, see if you're eligible, then take a 1-hour health survey to initially let us know where you are in your life, and then 2 surveys that are about 30 minutes each per year following. And then we're going to be able to understand what different types of environmental factors or risk factors are causing this discrepancy in a cancer journey. Another way that you can get involved in the fight against cancer is by joining our advocacy team. You'll see here from this picture, we had a lot of amazing nurses and patient navigators, social workers come with us to Albany a few weeks ago to talk about the introduction of a bill for patient navigation and the importance that patient navigation has in a patient's the patient and caregiver journey through diagnosis, and as well as ensuring that people have access to the adequate care that they need. We also talked about the importance of research is happening at such a rapid base, but we need to make sure our laws are keeping up with those changes, right? So ensuring that people have coverage within their insurance to get those lung cancer screenings or get their full follow-up colonoscopies. So these are really, this is just a way to use your voice by talking to your lawmakers, sharing your thoughts, and it's just was a very powerful day where we saw a lot of action happen. And one of our lawmakers actually signed onto the bill immediately after meeting this wonderful group of individuals, which was so thrilling. So what's next? How can you get involved or just be a bigger part of the fight against cancer? And the first thing that I hope we all got across to you is get screened. Early detection truly saves lives. So please, if you are not up to date with your cancer screenings, get up to date. Take the time to put your health first. Also share with your loved ones your family history so that they know what their risk factors are. Take that Cancer Risk 360 survey so that you can understand your risk factors. Also, come and join us. Northwell is an amazing partner, as we said, but come to our local Relay for Life community events or Making Strides Against Breast Cancer walk at Long Island or Eastern Long Island, where you can just walk. There's no registration fee to be a part of it, and just share your voice and share the community that we need to take a bigger stand in the fight against cancer. Share on social media, volunteer as an advocate a driver or come visit us at Hope Lodge. You can cook dinner. You could stay there, obviously, if you need the service yourself, or help share the word about our cohort study for Voices of Black Women. We truly have a long way to go to get to our 100,000 women to join. And we know that we have some great advocates who are sharing their voices, but we need it to be spread more. And of course, knowing that the 1-800-227-2345 and cancer.org resources are available to you, your families, and your patients. Maribel, I think we can open it up to questions if anybody has anything.
Yes.
Absolutely. Mhm.
Thank you guys so much for the presentation. It was an amazing presentation. And yes, if anybody has any questions, you can enter them in the Q&A feature at the bottom of your screen. All questions will remain anonymous. After the presentation concludes, I'll share with you any resources that Maribel and Katie share with me, along with their emails. So if you want to reach out to them with any questions or wanting to get involved, you can definitely reach out to them. Okay, let's see. Let's give it a few moments here to see if anybody has anything.
I'm going to stop sharing just in case.
All right, it doesn't look like anybody has any questions, but if anything comes up later in the day, Maribel, I could share the PowerPoint with them, correct?
Absolutely, yes. I'm going to send it to
Alright.
you right now. Yes,
Okay,
thank you.
awesome. So yeah, I'll share the PowerPoint with everybody. You can definitely review it, and if you have any questions, you can email them off to me or at matherhospital@northwell.edu. And once you exit the webinar, you'll see a brief survey. If you can complete that survey for us, that'd be really appreciated. It helps us plan our events for the year. So thank you again for everybody who's joining. Thank you again so much, Maribel and Katie, and I hope everybody enjoys the rest of their day.
Thank you. Bye.
Thank you, everyone.